City, Abuja, and other parts of the country. We bring you updates on the impact of the coronavirus pandemic on the global, African, and Nigerian economy. Let us give you the developing story around the current confirmed cases of coronavirus in Nigeria. It is now 190, with 2 deaths and 20 recoveries. We'll be discussing today around subnationals and their roles in mitigating the risk and challenges of coronavirus pandemic in Nigeria. And with me today is our regular guest now, Mr. John Wese, a strategic management consultant. Thank you for the time.
Thank you, Otto. Thank you.
Yes, sir. As usual, you're always looking relaxed. I mean, this lockdown is really bringing out your refreshed side. I think it's a good, it has its own advantage, challenges, but they're learning points, well, like we've been discussing.
You guys have said we should rest, we should take it easy. So every one of us, we're doing our best to take things easy and realign. Yeah. That's what we are doing. Thank you.
One of the faith leaders said he's now on a compulsory holiday for the month of April. But like you said, it's a refreshing time and there are opportunities despite the challenges we see. Now, the subnationals are very critical. Most people like to look at the federal, but when it comes to issues like pandemic, even epidemic, there are roles that the states must play because they are closer to people than the federal level. And ever since this outbreak of the coronavirus, like we've announced now, 190 cases, we've seen that it's spread across states. Lagos has the highest of over 90 now, over 90 cases, and followed by the FCT, which justified the lockdown that the president announced. Since then, we've seen the National Economic Council, chaired by the Vice President, meeting with all the governors to explore ways of addressing this situation, minimizing the effect and mitigating the risk. Recently, the Vice President now chairs a committee with 7 state governors and the Minister of Finance to look at palliatives for the citizens at the state level. A lot of people have been complaining on social media interactions saying that, yes, most states have locked down, but they did not plan palliatives for the people. Informal sector plays a major role, and they're locked down too. So I'd like your thoughts on this aspect of the palliatives, because it's been a burning discussion now.
Otto, thank you. I think, again, we may be unfair to say the states have not planned. Maybe they've not planned properly, but I'll be surprised if other states, apart from the main states where we are seeing cases,
like Lagos and Kaduna,
cases coming up, that they have not done things. I will be surprised. However, but I think some of them are doing some things. Yes, it may not be as pronounced. If you look at what Lagos, for example, is doing, what Osun State is doing, what Oyo State is doing, because their governor happened to have tested positive. It then means there are things that they are doing. With the committee the Vice President heads, all right? So I think we don't know what the outcome of that meeting has been, or what the mandate is, or what their goals are, but I'm sure it's holy. My take is we should expect that they should distill the palliatives, whatever the federal government is doing, and whatever they themselves as states are doing to do that, to support and prepare. What we should be doing more than anything else is prevention. And that's why the lockdown should gradually spread to adjoining states.
Border states?
Yes, adjoining bordering states. For example, Bayelsa has done the same. Delta has done the same.
Akwa Ibom had 5 cases. Cross River has taken action now.
So you could now see. So just creatively do that. We're not asking for, like I argue, my argument is we cannot have a total lockdown.
In the country?
In the country. We can't survive
it. We can't afford it.
Already, our citizens are already agitated. You know, they are restless, principally because of livelihood, right? But I think, if you ask me what the Ministry of Humanitarian is doing, my argument will have been distill those funds to the states, together with what the states are doing to reach the citizens in each state. That, in my view,
shouldn't be them controlling it.
No, it shouldn't be that. They can provide supervisory guidelines. This is a federal government program however, Akwa Ibom, Delta, Edo, you do this. You do this. Because they will know where their vulnerables are. You get the point?
Yeah.
And they could do that through local government. But it should be so structured and straightforward, you know, that accountability becomes what?
Very
easy.
key.
I mean, we are told 5 billion naira has been spent within a very short period. Somebody says, or people say it's debatable. I like to see the facts.
Though that information has still been reviewed by those that provided it, because in this area, one has to be very clear on the kind of information you pass
must
across.
be very careful, which is why I said I would like to see the facts, the data to support how it has been disbursed. I am not questioning that disbursement hasn't taken place. I am saying disbursement has taken place, but let us see the way it is. Okay. You get the point. So I think, yes, the subnationals, by the way, Lagos has actually discharged 23 in all as at this afternoon. 4 other people were discharged today. Yeah. So total discharge, I think, is actually 23 as at this afternoon.
We will update that in our
subsequent and that's good news. So that tells us, as that news came, it's a hope builder.
Of over 20 recoveries.
Yes, it is a hope builder. You get my point. Yes. However, from the last news conference the NCDC DG just had, and the Federal Ministry
and the task force, they
just had this afternoon a few, an hour or so ago, they are telling us that total we have tested to date is about 3,000. Come on.
That's why they now have to increase the capacity to 1,500 per day. I mean, UK does 15,000, America's been doing 10,000. They want to scale because of the population.
The reason is capability, the skills, the talent. Do we have the doctors and the nurses? Do we have the professionals to do that? Do we have the equipment? Do we have the reagents? Yeah. So if we don't have that, which of the industries, we said that yesterday, can reverse engineer their processes in the pharmaceutical industries, for example, to produce these reagents, these critically needed reagents? Which one of them? Because we need to do more testing so that it gives us a way to now manage. First of all, prevent. Then the area is control.
Detect.
Control. Yeah. Once you prevent, once you put preventive measures, which is the lockdown, control is testing. Testing to now help us to manage how it is being spread or how we are seeing the pattern of the positive cases that are coming out, as the case may be. So I think, yes, the subnationals, again, can talk to the high net worth individuals and corporations and companies in their individual states to say, listen, we are trying to do this. We are all in this together. We are all in this together. How can you support your state and our citizens from this invasion? We should not take anything for granted at all.
At this time.
We shouldn't take anything for granted. We should spread our tentacles as wide as we can. You know, I don't know if you know any specific state outside of Lagos that is doing, you know.
I mean, Osun State set up a influential high net worth committee. People that have influence. People like the Oni of Ife, people like Pastor Deboye, I mean, prominent personalities in that committee just to look at how they can assist the state, mitigate the risk, and alleviate the challenges of the citizens. I think that is an example of what you just said now.
You see what I'm talking about? We know the citizens of our state, so why can't we reach out to them? Now, if Osun State can do that, what's stopping Edo State? What's stopping Adamawa? What is stopping Yobe? What is stopping Borno, Kano, Kaduna, and other states?
That will require a strategy where you show them that these are the challenges and these are the things you would like them to do.
Gentlemen, fellow citizens, these are the things we are trying to do to prevent, to control. We've got reported cases. For example, they should be able to say, look, we currently have reported cases or suspected cases. You know, I don't know the right terminology, but which is appropriate, of so requests. for this thing. But we are waiting
Yeah.
while the federal government is helping to ramp up test centers.
Yeah.
The states themselves can do that. This is where these high net worth individuals or highly influential citizens of the various states come in. That's where they come in.
Yeah.
And I'm sure it will be a big honor for any one of them at this
serve
time
and to be involved.
to serve and to be involved to help prevent and control this pandemic.
Now, in terms of practical, real-time palliatives, what will you be suggesting in terms of for states? I know that Lagos did the food banks for people. The target is feeding 200,000 households as families. Kaduna State also has food bank supplies, and some other states are doing the same. But beyond those food supply, what are the measures? Because lockdown, like you said, it can be challenging when you're not generating economic activities.
You see, because of the issue of social distancing,
Yes.
any attempt to try to create convocation, a gathering, then you are limiting the risk and you're exposing yourself. However, that should not stop states. What I think they should do apart from this is to think of using their words, go down to local government level, from local government level to wards, and find a way to reach out. It's like a hub and spoke, you know, a hub and spoke system. They can use that and reach out to them. What do you need? Food materials. Or come and supply food materials. In fact, that's a good question. An idea just came back to me. Why can't states buy off agricultural produce from our farmers?
That's
now,
various states.
In the various states, whatever a state is known to be producing, tell our farmers, we are going to buy your yam, we are going to buy your beans, your rice, your maize, whatever, your harvest. Bring it, or just tell us where you are, reach us at this number, we are going to reach out to you people, buy it, and spread it out to
because they must have had those produce before the lockdown.
Absolutely. So we could think out of the box to do that. Now, all those producing water, those small firms producing water, the same thing, we could approach them. The states could approach them and also say the same message. Those of you that still have water, because these are essential needs, clean water to drink. You know, those of you that have water, you can produce, they can get special permission to produce water. The state will buy them from you and do what? Distribute through the same channel.
Like states like Ekiti, they have Gussie water. So they could really use that to reach out.
Not just Gussie.
I understand. Other means, because there are people that are at the low end,
so that they can, because water is a critical issue.
Yes,
clean water.
Clean water, yes.
You get the point.
Because when you say wash your hands, it has to be clean water. Provisions.
Not even to wash,
I understand.
to drink.
Yeah, drink, yes. Drink is important, but when you're bringing this practice of washing hands, a lot of people that don't have access to this infrastructure too.
So they could do that. That's a good question, really. So I think states could do this, and the government buys it from them. You know, pay them. We're not even asking to pay at a premium. To pay at a premium to these producers, the farmers, the small industries. Just give us what you have. And as they are paying them cash, and they use their mechanism for disbursement at that level to disburse to different communities as they need. We have community leaders. Who, you get my point, at other states level. They may not be as sophisticated or as Lagos is, or probably as Abuja is, you know, the major mega cities in Nigeria. But as you go further down the local governments, so there are ways they could do this. And you're not going to reach everybody, but you're going to make your best effort.
To reach out to wider population.
Reach out to people. And people begin to have confidence in government again. The truth is, I think this government, or any government, federal, state, local government, here is an opportunity for them to generate trust back in our citizens.
A great opportunity for them.
A great opportunity, because they've lost the trust of our people. It's not there. So that's why there is that
challenge.
That challenge. That's why nothing is believable the citizens don't believe.
I mean, when you look at education, Lagos State's Board on Education brought out these models where the students can reach out via their state FM to listen to the programs and continue learning despite the fact that they are in a lockdown. Are those not other type of innovative ways? Because education is also key. I mean, education is being disrupted at this point, but there must be a strategy to engage the students despite the challenge.
That's a good one. You see, that's a state that is thinking, how do we reach out to our children? Those are the leaders of tomorrow.
Yeah.
How do we still reach out? So if you look at the airwaves, so they need to get across to them in the airwaves.
Yeah.
Probably talk to all, for example, how many radio stations do we have in Lagos, for example? I'm sure they're up to 20.
Yeah.
I may be wrong, but there are that many.
Yeah.
So how many hours of their airtime
can they give
to promote
programs.
education of certain range of people? If they don't have people who can present, they can liaise with people who can help them do that via virtual conferencing and things like that. So I think we can't think, we should look at, those other states should look at that. Radio stations, TV stations as well. They're local TV stations. I'm aware the NBC
several states have local radio stations.
They've told DSTV that they should
free to air channels.
Yes, they should make the local channels available free.
Yes.
We're all watching CGTN free. So what are we talking about?
Definitely. That's a good approach.
So I think that's fantastic. States should do that. I do agree with that idea. They can do that. And they can do that down to their local government levels.
Yes, and the wards.
Yeah.
So when we look at private capital, because you talked about high net worth individuals, there are some states that have major companies in their base operating. Apart from the fact that Lagos is Nigeria's economic capital, there are states and major companies operating, make their revenue, and sometimes they play a CSR role. In these times, we need to see them come up with strategies of supporting these states that are may affected by the pandemic. So what would you advise states in that regard in terms of attracting more of these private sectors in their domain to really, really support? We've talked about the need to increase testing capacity. We've talked about the need of emergency operations centers. When you look at what we have in Lagos, isolation centers, we need to ramp up and provide those facilities first responding to address this challenge.
I think I know of Delta and River States, the oil and gas companies in those states are already partnering with them. Don't also forget that most of the oil and gas companies or the multinationals, they're also strong on CSR.
Yes.
I am sure that they're already having those engagements. Again, people don't want to waste resources. If we are not making as much testing, if out of 3,000 that we've tested, the total that we have to date is 190.
190 confirmed cases.
190 confirmed cases out of 3,000 that has been tested. Trust me, that's some good numbers. When I say good numbers that our concern that the numbers will be higher than that may be okay for now. But it's not Uhuru, okay? So that's some good numbers. So states and the governors, and the companies, resident domiciled in their state, may be looking at other strategies to say, okay, fine, should we strengthen current state hospitals? Can we strengthen current state hospitals?
Yes.
They may not need to produce more infrastructure, more isolation centers, but can we quickly renovate, which is strengthening current health infrastructures in the states at all the local governments to be ready to address these issues.
Challenges.
So those could be part of the strategies that they are doing. Again, we don't hear so much about what is going on in other states, but I think that's an assignment which we need to do against
we monitor
our next, so that we can talk more about other states that what is happening there.
Yeah. Now, in terms of the suggestions from the Nigerian Governors Forum, you know that debts, we have a debt burden as a country and at state level. So suggesting that during this period, at least hold on this deduction so they can be able to pump up resources amid the demands and challenges of the citizens. What is your take on this?
I support, because other climes are doing the same.
Okay.
Other climes are doing the same. We are in an unusual period.
Yeah.
All right. So there should be a moratorium.
Okay.
You know, guys, let's step it down now.
Say 2 or 3 months.
Until probably 90 days from today.
90 days, okay.
By the grace of God. Also, they can sit down and do that. It only makes sense because it's also a concern.
Yeah.
It's also a concern for the lender and for the borrower.
Yes.
Okay? It's also a concern. So it's not just for states, for individuals and for corporate entities as well. You get the point. Yes. So what conversations can come to the table? Now, if we are not careful, many nations will go bankrupt.
Based on this
as a result of
part
this
of the pandemic.
Yes. Nations will crumble.
Italy is showing that danger sign already.
Nations are likely to crumble because if you look at the impact of this pandemic as a result of the global health systems, especially in emerging economies, you get my point. I think we are going to have that much later on in terms of the economic impact.
Yes.
We're going to have
the World Health Organization has said that Africa's health system has been fragile ahead of this time. And so with this challenge, it's under intense pressure. And there's need for us to really boost and build capacity in terms of the infrastructure in our health system. But looking at civil and military and even law enforcement relations, we saw the report from Delta State between a military officer and, of course, someone that was killed. How would you advise the governors and, of course, those commissioner of police and military officers, commanders there, to engage further to avoid this kind of situation? Because lockdowns, sometimes journalists are going on about their duty. We hear them being harassed. And then some people are also being harassed and dehumanized without even given a chance to speak up.
Well, I think as a barrack boy myself, so it's not a good scene or a good experience.
Yes.
What I think we need to do, this has been on before now, right? But because we've not been held, I think the authorities in the military, paramilitary, should educate their crew, to reorientate them, their crew. You could discover that a lot of people are under strange pressure, all right? And our citizens themselves, we also need to obey. People are under pressure. People want to be with their families. Yeah. And they've not seen their families for some time. Yeah. You get my point. So you can imagine. My younger sister, she's also a health practitioner somewhere in the US. In the course of this, she couldn't see her family for a number of days or a week or 2 plus before she recently went home after she was quarantined. Yeah. Do you know the pressure? Not to talk about our police force, our military guys who do not have adequate enlightenment about engagement, about civil engagement. Yes. So citizens should manage their communication with these guys. Yeah. While the military guys themselves should also relax. Everybody is under severe stress and pressure. Now, for journalists that are being manhandled or employees that are among essential services duty, because we've also seen such videos of how they've been maltreated, I think there must be they should have some form of identification or pass given to them. So that pass, in each state, so that pass should be conspicuously worn or displayed. Yeah. You get my point? So
like in election periods and all that?
Just like we do during election periods. Thank you, Otto. So that these skirmishes can reduce. Then, the average Nigerian, when the policeman or to do that myself, we're aggressive towards them.
True too.
They're human beings like us. So I think we should address them better. We should respond to them better. And I can say all of us are almost guilty of this, especially those of us who are big men, in quote. So the air we carry, they could quietly invite them and detain them and seek for clarifications until whoever they are working for can ascertain their identity with the appropriate passes.
Yeah.
You know, these are the things. It has to do with engagement and proper communication. Once they're able to do this, I think these skirmishes
will reduce.
Will reduce. Again, don't forget, this is day 5. People are under pressure. Excuse to flout, lay down
procedures of stay at home.
To stay at home. Staying at home is staying safe.
It's not just a Nigerian thing, globally.
It's a global
enforcement
issue.
Agencies are taking it seriously.
So we should respond to these instructions.
Yeah.
We should respond to these instructions unless we are providing essential services.
Yeah. Unless
we are providing, and we should have the appropriate identification and pass to show that we could do that.
Okay. In closing, what would be your final reflections for states? I know we'll still come back to this conversation about subnationals, but what will you be saying at this time? Because I know that the governors too are facing that pressure. The ones that are yet to have a case, they're all bracing up, hoping that it won't happen. The ones that already have, imagine Lagos State governor, over 90 cases. I mean, what do you have to say? Osun State, 14 cases.
I think the word that we could talk more, maybe in subsequent program, is resilience. Resilience. So resilience is very important. We need to show resilience.
Yes.
And resilience has lots of attributes at the subnational, especially the states that have been affected.
Yes.
Resilience is very important.
In terms of leadership, in terms of focus.
Yes, they need to help our citizens. Whatever communication they are sharing with us is, we are going to come out of this. We are in this together. We will overcome this. That's the word. Words of hope, words of encouragement, you know, words to share. Each state should share a history of how they overcame a significant moment. Each state share memories of which the younger generation do not know.
No.
Are you aware? Sometime in this state we had this issue, but we came together. Or our founding fathers came together. Or our stories of victories. That will keep all of us alive. That's and what together. I think we should be. Those are my closing thoughts.
Thank you so much, Mr. John Wese. I mean, resilience for leaders is very important at this time, despite all the challenges. Thank you so much for your time.
Thank you.
Yes. And that'll be all for this afternoon segment of the WebTV Coronawatch. And at the 5 coverage of the lockdown, you can visit our website www.proshareng.com to get updates from our market reports and analysis. You can also tune in by 9 p.m. for our updates and reports. And also, we wish you that this period of the challenging pandemic, you will be resolved to know that COVID-19 is not a death sentence. Show care and support to those who are facing the challenge. And for those who are really worried, it's a time for you to unite, irrespective of tribe, race, or tongue. We need to work together as a nation, because this cannot divide us, but rather unite us to achieve progress. Till we come your way again, thank you for watching. Have a nice day and stay safe.